Men on average die 5 years younger than women and at higher rates from 9 of the top 10 causes of death. So in honor of Men's Health Month, Dr. Brent Wallace from People's Health joins us to explore some important issues about that. Good morning.
Good morning.
So what are the big factors?
Probably the biggest factor for men is heart disease. 1 in 3 men, according to the American Heart Association, have heart disease, and that can include any sort of hypertension or heart attack, anything like that.
You know, one of the issues, and we talked about this a little while ago, is just getting guys to go to the doctor.
It's a big problem. Men go to the doctor probably half as much as women do, and men tend to wait longer to go to the doctor, so they're really sick when they show up.
And oftentimes when you're really sick, that's, for example, I mean, just to drive that point home, you might have a cancer that's going to kill you, that if you had just gone to the doctor when symptoms showed up, you might have lived decades longer.
Yeah, people put things off for a long time and tend to kind of play things down. Men try to be tough. And so what we do when we're talking with our patients that are male is we try to emphasize to them the need for preventative care.
To combat the I'm a big tough guy and I don't need to do that sort of thing.
Right.
You know, you talked about some of the numbers. Stress is a big factor in this, so I know there have been stories over the years pointing out that sometimes the gap is narrowing a bit as women are more in the workplace. Not that there's not stress involved in raising children at home, but as society has changed, or as women have juggled now multiple aspects of their life, are they kind of creeping up?
That's true. It's equalized a little bit. I think the problem with men, again, goes back to their lack of getting care. And so men tend to go longer with anxiety, and therefore men often have higher levels of depression and even suicide.
Prostate cancer is a big issue, obviously. There's a myth out there that prostate cancer only affects older men.
Definitely, and that's not true. Typically we start being aware of prostate cancer and looking for prostate cancer after age 50, but we've had men as young as their 30s, especially those with family history and African Americans who can develop prostate cancer earlier.
That's a good point, and maybe for anybody in the audience, if your parents got heart disease, if your parents had diabetes, how much of a factor is that? I mean, how much do you need to pay attention to what mom and dad are suffering through either at 50 or at 90?
Probably it's one of the biggest risk factors, along with lifestyle, things that you do with your health, having a family member, especially a first-degree relative, so a mom or a dad or a brother or sister with heart disease is going to lead to a much higher incidence in yourself.
So getting a checkup can help and help you live longer.
Very important to see your PCP.
I realized we were kind of dark. We had a dark theme going here, Dr. Wallace, but we kind of ended on maybe a happier note. All right, appreciate that.